So I could start up with that. And the key thing to bear in mind, and I don't know where people have traveled or where people may have visited before, where people's families are. But if you think of viruses such as dengue fever, for instance, there are different strains, different variants of all viruses, and all viruses evolve. So it's not unusual for there to be different variants of the virus that causes COVID-19. So to answer your question, the dominant variant in the UK currently, and by dominant, I mean 99% of all sequence isolates, is the Delta variant. And the good news is the vaccines, the 3 currently available vaccines through the NHS COVID-19 vaccination program, are all effective in terms of reducing your risk of severe illness due to COVID-19. But the important thing is that you need both doses to have that maximum protection. So the latest estimates that I've seen from Public Health England is that after the Pfizer vaccine, after 2 doses, your risk of severe disease is reduced by 96%. After the AstraZeneca vaccine, your risk is reduced by 92%. So I wouldn't get too caught up in that 96 versus 92% comparison. They're both very, very good. And they both really reduce your risk of hospitalization or severe illness. But the key thing here, unlike the previously dominant variant, the Alpha variant, the protection conferred after 1 dose of either vaccine is drastically reduced if you encounter the Delta variant. So the important thing here is that when you're invited to get your second dose, that you should, because that is the best way to reduce your risk of any severe illness due to COVID-19.
Thank you for that, Dr. Ramesh. I think that's a really good point. One thing I will emphasize here as well is the idea that vaccination or mass vaccination reduces the emergence of new variants. It absolutely reduces that. And I want to put that out there to anyone who perhaps may be wondering, if we're going to get a new variant anyway, which the vaccine may not be effective against, why bother? Vaccination reduces the risk of new variants emerging. And we get new variants because the viral genome is unstable. And so changes are always occurring, which means that new offsprings, I suppose you could look at them like that, new babies of the virus, I suppose you could look at them like that, are just always being pushed out in the population. But the more we vaccinate, the more we sort of diminish the ability of transmission and spread of the virus in the wider population. And that also reduces the risk of more variants emerging. So that's the benefit of vaccination here against viral variants.